Welcome to Baby Snugs and Coffee Mugs. I'm Krista.
And I'm Kelsey. We're both labor and delivery nurses from Minnesota. In this podcast, we'll be covering all things pregnancy, delivering in a hospital, and caring for yourself and baby postpartum.
This podcast is meant for educational and entertainment purposes only, so please seek medical advice from your healthcare provider. We are so excited for you to join us, so grab your coffee, snuggle up, and keep on listening.
Cheers!
Cheers! All right, welcome back everyone to episode 2 of Snugs and Mugs.
Welcome back. We ended last week with first trimester, so why not jump into second trimester, which is also known as the golden period. I hope everybody is starting to feel better if you're following along in real time. We are still on every 4 weeks for appointments generally, unless, of course, you were told otherwise by your provider. But I believe the next one would be week 16.
Yeah, we are at the 16-week visit now.
And again, we have your records pulled up.
We do, yes, to just help us remember.
Exactly.
So you're at your 16-week visit now. And as Kelsey said, we're going every 4 weeks. So you can kind of at this point expect every time you go in, they're going to check your vitals, make sure your blood pressure's okay, and kind of have that baseline early in pregnancy to see how things trend. So that's pretty much the first thing you do. And then you are going to get your weight checked. So pretty much from this point on, you're going to have discussions with your provider about an appropriate amount of weight gain that they want you to gain, and it really just depends on the person and your BMI, and they will give you that recommendation on how much they think is appropriate for you to gain during your pregnancy.
Okay.
And it's just a goal. It's not, no one's perfect, so it's just kind of a goal they give you, and you just go from there.
Makes sense.
And then hopefully at this visit, which is super exciting, you get to hear your baby's heartbeat for the first time if you haven't.
Yay!
Yeah, so ideally they can find it on a Doppler, but for different reasons, they can't always at 16 weeks find the baby's heartbeat on the Doppler, which is okay. I feel like it was my second baby. Yeah, my second baby, we couldn't find it very easily until more like 17 or 18 weeks because of where my placenta was.
Okay.
Yeah, so it just depends on the person, but if you aren't able to find it on a Doppler, most places have a bedside ultrasound that they can bring in, and they will just bedside ultrasound and show you the heartbeat that way, which is nice. And then another thing in this visit they will discuss with you is a optional genetic testing again. This one's called an alpha-fetoprotein test. So last week, guys, we talked about the Maternity 21, which looks at chromosomal abnormalities, and this one is neural tubal defects. So what they will do is they take a little bit of your blood, and then they kind of put together a whole list of a risk assessment of different, basically, aspects of yourself, and then they will give you a risk at the end and tells you how likely you are for this to occur. So again, it's not a diagnosis, but it will tell you if you are higher likeliness of having a neural tubal defect or not so likely. So if anyone has heard of spina bifida, that is a neural tubal defect.
Sure. And then this is an optional test.
Yeah.
Correct. Okay.
And you don't have to get it at 16 weeks. I think with one of mine, I got it at the 20-week appointment instead, so it's not necessary. Again, it's optional, but yeah, if you choose to do that, that's great.
Yeah, absolutely.
So now you're 16 weeks, and I feel like at this point, most people kind of notice that their body is changing.
That bump is coming.
Yeah, it's no longer just bloat. There's an actual baby behind that little bump that's showing. And so I feel like there are a lot of providers that will be discussing kind of your body changes, and if they don't, it's a great time to start asking about those things. I know we see a lot of people that come in with what's called round ligament pain.
Yeah.
It's just a super common discomfort, I feel like, that a lot of women feel and don't quite know what it is.
Mm-hmm. Yep, so that bump is growing, your uterus is growing,
Mm-hmm.
Those ligaments are stretching.
They are, and it's not comfortable. And the size that your uterus goes to the size that it is at the end is really amazing. So it's not surprising that it's uncomfortable, but it still hurts, and it does take people off guard a little bit. So what most women will feel is kind of like a sharp pain, typically, on one side if it's sudden. Otherwise, it can be kind of like a dull, aching pain that's like a little more constant.
Sure.
But
What do you have any tips on what helped you when you were
yeah.
experiencing that?
Yeah, so typically what I would do, honestly, I would rest a lot. I just feel like once you like pull it really hard, it just hurts. So I
Yeah.
feel like just resting and getting yourself not overstretching it anymore. But otherwise, moving position slowly can really, really help. So if you think like you're sitting down and you stand up super quick and that stretch happens all of a sudden, it can cause extra pain, extra discomfort.
That makes sense.
And then I have a little heating pad that I put in the microwave. It's like has little corn kernels in it. And so I would warm that little guy up and just slap her on my side and
I
call it a
think a
day.
heating pad is going to be everyone's best friend.
Definitely, yes. Since you cannot take ibuprofen. Again, you can try Tylenol. I didn't find that to work. I just felt like heat and rest were kind of my two things that
Okay.
really helped. And another thing I feel like people start noticing is the boob discomfort. So if you already are not feeling that, I feel like by this kind of point, they're starting to feel a little more full. You might be upgrading your bra size here, which I noticed I had to. But I feel like a lot of women kind of get that like discomfort in their breast tissue. It just is a really, really common thing. Your glands are getting ready to feed your baby, and it's normal, but it's, again, uncomfortable.
Yep.
And then they will most likely ask you if you have felt the baby move yet.
Okay.
So a term I feel like medical professionals use is called quickening. You might also hear it called like fluttering.
Okay.
It's pretty common. So yeah, at this point, it is a little early for your first baby to feel the baby moving at 16 weeks, but some people do.
Oh, okay. Fairly early then.
Yeah, yep. And I feel like the more times you're pregnant, the more quickly you are to feel that movement. It's just easier to decipher between, okay, what was a gas bubble, what's just normal, like intestinal movement, and what is actually the baby moving, because it is really, really subtle in the beginning. Actually, with my first pregnancy, the reason I even knew that I was feeling the baby move is we were doing an ultrasound at work, and I think I was like 18-ish weeks. And I wasn't looking because I didn't want to know the gender. And my friend was like, oh, let me know if you feel the baby move. And I was like, there? And she's like, yeah. And I was like, no way, really? And like we did it like 3 or 4 more times. And I like, that's how I like got the correlation of like feeling the baby move, which was super, super exciting.
That's fun.
Yeah. So not everyone has that luxury of a ultrasound at their work. But yeah, it was hard for me to know it until I knew that's what I was feeling.
Yeah, absolutely.
And it gets easier with each pregnancy.
Experience then.
Yeah, exactly. It's not your first rodeo anymore. And then I think just kind of planning for the future is just like the next thing that they might talk about, not necessarily, but I think at 16 weeks, it's beneficial for your brain to start going to those places again. Like, how am I going to feed my baby? What's my plan for that? If I am planning to breastfeed, again, looking into classes, and we are going to talk about this over and over and over again, I feel like, because it is really difficult to breastfeed, and the more education you have, I feel like the easier or smoother process you're hopefully going to have.
I completely agree. Those classes are going to be so beneficial if you can get your hands on one.
Mm-hmm, definitely. And I'm sure there are plenty of online ones if you cannot attend an in-person one. Other things to think about is your maternity leave. So as we know, as a country, we have terrible maternity leave, which is lovely for all of us mothers out there. And even fathers. But there are some places that do require like that paperwork filled out really early.
Good to know.
Yeah, so it's not a bad idea to start talking to your employer if you are comfortable talking about your pregnancy at this point, or at least soon in the next few weeks.
Sure.
Kind of figuring out what the plan for your leave is going to look like.
Good idea.
And then the only other thing I think that we kind of touched on is the ever-changing visitor policy. So we see this
Never
all the
ends.
time at work. It's just always changing. The whole COVID policies are all changing, and it's not a bad idea to just keep track of those throughout the rest of your pregnancy.
Yep, I agree. Again, COVID, it changed everything, but hopefully we're kind of seeing like, the light at the end of the tunnel with this. But again, my guess is your hospital does have some sort of visitor policy. So please just ask. So
Yes.
we're not the bad guys.
I know I hate being the bad guy because, like, I don't want to kick anyone out. I don't want to ask people to leave. I just am being told by somebody who makes rules that is not me.
Yeah.
But yeah, so I think that kind of brings us to our 20-week visit now.
Okay, so that next visit it's a good one because you are getting an ultrasound,
Yeah.
looking at everything.
It is a huge, comprehensive anatomy scan.
Yeah, and then just a reminder, I think we talked about this last week, but not all clinics have radiology departments in them, so you might have two separate or appointments, I guess I should say. Our facility, again, we have radiology right in the hospitals or the clinic, so you'll go to your scan and then you'll go meet with your provider to review the results.
Yeah, exactly. So I'm actually just going to pull up my own visit to just make sure I touch on everything that actually gets looked at. So, again, you show up to the radiology department or room and they lay you down. I feel like the first thing they ask you is like, do you want to know the gender of the baby? Because they don't want to ruin it for you. That's not their intentions. So I went into it 3 times not wanting to know, but some people want to know. And I don't know that there's necessarily an order that they do this, but they want to make sure they ask you so that when they put the ultrasound wand on, like they have you look away if it's an area where they shouldn't have you be looking.
Yeah.
So I'm just going to read the list of kind of body parts that they're going to look at. But they look at the baby's head, face and neck, the chest. So they'll look at the heart, their abdomen, their stomach, their kidneys, the bladder, the spine, all the extremities, so the arms and the legs, the genitalia, which is your cue to look away if you don't want to know, and the placenta. So they want to make sure that the placenta looks normal, and they look at the placement of the placenta. And then they look at the umbilical cord.
Okay. Mm-hmm. And then if I'm remembering right, they're watching your fluid level during this scan as well?
Yes. They do look at your amount of amniotic fluid that they have, which is kind of a cool measurement. They kind of just measure like pockets of it. It's really cool.
Okay. Interesting.
So yeah, those are kind of the main things that they're going to go over and look at you. So forewarning for everyone, the ultrasound techs are not allowed to really discuss anything with you. So if they see anything that is abnormal or if you're asking them, they're technically not supposed to tell you because that is not their job. It is the job of your healthcare provider to be discussing those ultrasound findings with you. They will tell you the gender if you want that, but other than that, they kind of just wait for your provider to talk to you.
Yep.
So it is common that we see that people do have to return for another ultrasound because they can't always see every single thing that they're looking for.
Super common.
Yeah. And like, for example, with my first pregnancy, they couldn't see all 4 chambers of the heart. So we had to do a follow-up ultrasound in 4 weeks.
Okay.
We did it at the next visit. So after you get all of that done, then you go again. This might be a different day or later that day, whatever. But you go and meet with your provider, and at that point, then you would discuss the findings of your ultrasound. And so, again, if you need that follow-up, they will tell you, like, hey, they didn't get to see the head, or they didn't get to see the face, or whatever it might be. They'll let you know what they weren't able to visualize, and then they'll make plans with you for that follow-up, or they will discuss with you if they saw any abnormalities.
Yep.
So, things that they could tell you is, like, any kind of placenta issues or cord issues, kind of a whole wide array of things. So,
it's an important.
It is a very, very
appointment.
Appointment visit. Like, it is a very big scan. Again, the gender is very exciting, but they really do look at every little detail of your baby, and it is a big one.
That's such a good point.
But after all of that is said and done, you do get to see your baby, which is so much fun. Like, at your 12-week or whatever time in that first trimester you got that ultrasound, whether it be anywhere between 8 and 12 weeks, like, your baby's a tiny little peanut. Like, it just looks teeny. And, like, if you're at 8 weeks, like, it kind of looks like a gummy bear.
Interesting.
Like, it looks like a little blob with, like, little nubs because, like, its arms and legs aren't formed yet. So, like, going from that to, like, seeing your baby at 20 weeks is just a huge difference. Like, they look like a little person in there, like, which they are. Like, everything is developed. It just needs to grow.
And the ultrasounds are incredible these days. You can see the features
No.
so well. It's so fun to see.
I know, and those like 3D ones are, I thought, a little frightening the first time I saw it, but it's really cool. Like you like literally can see the features of your baby. It's yeah.
Start to figure out who that baby looks like,
And if
other
you're
sibling or mom or dad.
usually not me, but that's okay. But I think that kind of wraps up the 20-week visit. It really is all about that anatomy scan.
Perfect. So then heading 4 weeks later again, roughly around
Yep.
24 weeks, you're going in again.
Yep, and then we'll head back into the office at 24 weeks. And I feel like, again, at this point, that weight check, the vitals check, making sure your blood pressure's okay, all those kinds of things happen. Then at this visit, we're kind of more going from like, okay, we're starting to plan things to like, we should kind of have things somewhat decided for now. With that being said, you can change your mind throughout the rest of your pregnancy, obviously, but you kind of really want to start like making concrete plans. So at this appointment, like, yes, I'm going to breastfeed. Yes, I want to formula feed, or I'm going to do both. Whatever it might be.
Yep. No, you definitely want to kind of have an idea. Again, you can change your mind at any time.
Right.
However, kind of start thinking about that so you can plan it out.
Yes. They are going to want to discuss with you what your plan for pain control in labor is going to be.
Okay. So talking medicated, like an epidural, or unmedicated. And I guess I'll just throw it out there now. Start talking with your provider the options that are at your facility, because that is going to vary from each place. And if you are starting to talk unmedicated, start doing classes, start doing research. It's a big thing.
Yeah, you're definitely going to want all sorts of tools and tricks and tips and everything that you have, so that if you get there and one thing's not working, sweet, on to the next.
Yeah.
Like,
Yep.
so yeah, talking about that. Oh, and then they're going to want to ask you if you have an idea who the pediatrician's going to be.
Sure.
So you're not required to have a pediatrician. You can also have a family practice doctor. So whatever you decide you want to do. But I think sometimes people forget that somebody has to take care of the baby after the baby's born.
Yeah, it's not your OB, you guys.
No, it definitely is not. Or the midwife. They do not want to take care of your baby.
No, they don't have that part of it. So, pediatrician, the main reason for that's kindergarten, or sorry, birth to 18 years old, family practice. They can see your whole family. So I feel like some people just find that easier. Do one provider that knows the entire family. So both are great decisions. So
Yep, and just feel out your options, see what's in your area, most likely in your insurance umbrella, and then
good point.
And then they will discuss too if you want to do a circumcision, if you are having a boy, or if you will be having a boy, if you're unsure of what the gender is at this point. Just another thing that I feel like you have time to talk about, and again, change your mind. I feel like we've talked about this. Like, it's super common in the Midwest and way less common on the coast. So,
Yeah.
And again, it's up to the person. I believe at this point there is a charge for it, which we'll kind of discuss later. But yeah.
Yeah, we'll get into details about all this.
And I think going forward from there in that 24-week visit, now it's more like things that you're going to start looking for. So you're 24 weeks, your baby potentially can live outside of the mother at this point. So there is a big list of things that are kind of like, this is what you need to be looking for now. So I think the first one we want to talk about is what's called gestational hypertension, or high blood pressure.
Super common.
Very, very, very common. So they're going to tell you some warning signs or things that you should be looking at. And if you have these things, to please contact your provider, call your clinic, call your nurse online, and they can direct you on what you should be doing. But any kind of swelling in your face or your hands. So swelling in your feet is normal. If you start swelling in your face, your fingers are all of a sudden super puffy, you definitely want to let them know about that. If you're having any constant headaches that aren't relieved by any rest, any medication, stuff like that, that right upper quadrant pain. So if you want to know what your right upper quadrant is, if you are feeling your rib cage, it's your rib cage on your right side, kind of right underneath your rib cage, and that is where your liver is. So high blood pressure can harm your liver, so it can get painful. And that is a huge warning sign for high blood pressure. And then blurry vision and seeing spots. Again, when you have high blood pressure, it affects the vessels that are in your eye, and you start to see what people call as floaters. And I feel like we see people often that come in with that.
Yeah, they absolutely do.
And then the next thing they're going to talk about, so now you're feeling your baby move a lot more, right? We went from that like, oh, am I feeling the baby move to now I'm 24 weeks. So you know your baby. You know when your baby's awake. You know when your baby has sleepy periods. For us night shift workers, my babies always were wild during the night. They did not let me sleep. Like when I was not at work, they were confused why I was laying down and they're like trying to run around. They're like, let's have a party.
It is awake time, Mom.
Yeah, they were very confused when I was trying to sleep at night. So once you start noticing that, you can start noticing what is called decreased fetal movement, which is not feeling the baby move as much.
Yep. And so if you feel like you're starting to experience that, they are going to tell you right away to do a kick count. So essentially, you want to feel 10 movements within 2 hours. To hopefully not have to lay there for 2 hours, lay on your side, drink some cold water, and start noticing those movements. If you're not feeling it, you want to call your provider or a number that they've provided to you to get checked out.
Yeah, either one of those for sure. And that kind of snowballs right into preterm labor. So you're at the point now where, again, you can have all these kinds of warning signs of preterm labor, and you would like to contact your provider or, again, that number they provided you with, like, right away. So if you are having a change in your vaginal discharge is a huge sign. So I think we kind of touched base on this last week, talking about how normal discharge can be. If you're seeing like brown or bloody discharge, that is a huge concern, and you definitely want to call. Along with that, a lot of people will notice kind of constant abdominal pain, that constant low back pain. It's just kind of like pressure down there, like a full feeling that like is staying there. It's not going away.
Sure.
You can have all sorts of discomforts in pregnancy, but something relieves it, or they like go away at a certain point. Like you take a bath and it's gone. You lay down for a while, drink some fluid, like maybe you were a little dehydrated and it's gone. But these are all kinds of things that like don't go away. Other things is actually feeling contractions. So this can be a little bit confusing because people can have what's called Braxton Hicks contractions. So a Braxton Hicks is a tightening of your uterine muscles that isn't necessarily painful, but you definitely notice them. Where a contraction is more uncomfortable or painful. It doesn't mean it has to be excruciating pain, but you will have like discomfort. So those are kind of really the big warning signs of preterm labor. And I think that is about wrapping up the 24-week visit, is just knowing all those warning signs, knowing when you should be contacting your provider, your nurse online number, and then you're headed into your third trimester.
Yay! That's a big one.
Oh, it is now. So your next visit is typically, again, this is for the average pregnancy, typically around 28 weeks. And you are in your third and last trimester, and you're on your home stretch.
So exciting.
So we will be back next week. We will dive into what the whole third trimester entails. And until then, we hope you guys have a great week.
Thank you.
Thanks for listening.